This is Eva Sheppa, host of From Help to Care, sponsored by Family Health Center of Marshfield. Today I'm joined by Dr. Murphy, a dentist at our Chippewa Falls Dental Center. Welcome, Dr. Murphy.
Thank you. Thank you for having me.
Great. Nice to have you here. I'm wondering if you could share a little bit about yourself so that our viewers can get to know you a little bit.
I am a general dentist with Family Health Center, currently working out of the Chippewa Falls Clinic. I've been with Family Health Center since 2014.
What kind of population do you see at the Chippewa Falls Dental Center?
We see primarily state-insured patients at the center.
And do you see all ages? Do you see specialize in pediatrics at this time?
Interesting question. So as a general dentist for 10 years, I saw a wide range of underserved populations, veterans, patients with special health care needs, children. It's actually been an incredible joy to be able to learn from these populations, and probably why it took me a long time to hone into pediatrics, which I've learned so much being with Family Health Center, and I will be attending a pediatric residency and hopefully come back to Wisconsin as a pediatric dentist.
And so you'll be able to see those pediatric cases. Will you see special pediatric cases or any pediatric case? Do you know how that will work yet? Maybe you don't.
My passion has always been working with federally qualified health centers and public health. It's all I've known.
Yeah.
And I believe in access to care for all of our youth, and I think that has been what has been incredibly invigorating about being a part of Family Health Center is, I've seen, ones that are, they're excited to see the dentist, and it's like, no cavities done. But primarily with our patient population, the cavity risk tends to be higher, and with difficulties of access and transportation, it may not always be easy to get care at a center where state insurance is accepted. And so with that, at times we do see a young 5-year-old that comes in and has several cavities, and where we need to be able to work to earn their trust. And I think that's where I've really found my calling, is becoming a parent and seeing it from the lens of the patient's guardians, everything they went through to be able to bring the child to the appointment, but then knowing that because they haven't been able to make that 6-month recall that many of us associate with the dental office, that the beginning appointments may be more about building that trust and alleviating any associated dental phobias.
Yeah.
And so I would like to do the specialty training because my experience is primarily in the clinic, and I have always heard the vision on the dental side of how do we get our youth who have special health care needs, how do we get care? And the way I look at it is being able to train, working in hospitals. I'll be with the level 1 trauma center working side by side with behavioral health and medical. And so I will be seeing children who are going through chemotherapy or heart transplant, more medically complex cases that I hope to be able to bring that back to Wisconsin and be able to provide training to the healthcare community, whether it's encouraging general dentists to expand their skill set or their scope to work with youth with special healthcare needs, or bringing the health community together so that we can minimize some of these barriers to care, access to care, the continuity of care can be a challenge. If we do see something medically or from a behavioral health perspective.
Yeah, what do you do with that? What do you do with that when you have them in the dental chair, right? Mm-hmm. And how to get that care to that person in an efficient manner, and that can definitely be a challenge. I think also people think of dental care totally separate from health care, but we've really learned that what our mouths are doing and what is happening in our mouths can affect ourselves medically in other organs of our body and other conditions that we have. Can you talk a little bit about how dental health can affect other parts of our body and that it really is all connected?
Yes, absolutely. We see how the oral health can affect other areas in terms of if we're talking about health conditions, diabetes, pregnancy, cardiovascular disease, heart disease. We can actually see changes in the gum tissue with, for example, poorly controlled diabetes, uncontrolled diabetes, and we are able to see on the radiographs bone loss, and it's really important when we see these cues in the mouth. We ask the patient, I see that you're taking diabetes medications. How has your diabetes been? And then that's where it opens up that conversation for, I haven't been taking my medications because they are incredibly expensive.
Yeah.
And or my medical provider is aware, which that always brings relief for me. And we are trying to get my A1C lowered or it's stabilized, but usually it's that it may be higher, and then it's okay, well, let's coordinate that care with your medical provider and be able to help prevent that progression of gum disease and also give you just a greater quality of life with being able to smile and chew all the wonderful foods in life.
Yeah. I think if we did a poll of everybody who's watching, I think it's very few people who've had their dentist ask, how has their diabetes been? Or take your blood pressure when you come into the dentist office. And I know that those are the sorts of things that Family Health Center, as a federally qualified health center, has done in the past. It has continued to do in certain sites, and we're looking to rejuvenate some of that work so that we can really provide that holistic care to our patients, which is super important, not only to Family Health Center, but just to society as a whole.
Yes, especially with diabetes and high blood pressure. Statistically, patients see their dentists more than they do their medical providers, especially in the pediatric world. And so to be able to say, your blood pressure seems a little elevated. Have you had it checked recently? And then just meeting that patient where they are in their health journey, I think, is so important. And being with Family Health Center for a long period of time, I think it was normal to want to, okay, this is what I've learned from the textbooks, and I have to tell you everything at your first appointment. And then just really seeing that as this provider-patient rapport is built, and then being able to open that door of, okay, how can I improve my overall quality of life and wellness. And I've definitely had a few patients say, thank you for directing me to the proper resources with my blood pressure. You saved my life. And I'm like, oh, that is, because life is so busy. It can be so hard to, go to the pharmacist, pick up your medications, have your annuals, and then along with family and work obligations. Yeah. It's not easy.
To have that extra safety net to stop and say, hey, this is a concern, and how can we help you get that addressed is pretty important. Yeah. So, we're talking about when folks come in the door, they've already got a dental issue typically. But I know I was reviewing your notes that you had for me, and one piece that I'm just trying to find here, sneaky foods, I think was what you called it, where I just want to hear more about these sneaky foods, because it seems like a big secret of what might be out there attacking our teeth, maybe? I'm not sure.
Yes. So the sneaky foods can look like, out of convenience, we may have a pack of dried fruit or fruit snacks. It has the word fruit in it. It's healthy for us, but then the stickiness of it can stay in the grooves of our teeth, and then if it's not removed, that can be a culprit for cavity formation. And then it's also interesting with beverages. There are so many to choose from, and it'll say, 100% real fruit, but it's a sugar source. And so that's how I believe in moderation. I think that's really important. And so I try to just say, well, let's just try to think of this as like a frequency to volume. So if you're craving juice, well, let's try to have a cup of it at a mealtime rather than sipping on it throughout the day, or a lot of us rely on coffee, or I guess I do. Yeah. And when it has the sweeteners in it and we're sipping on it throughout the day, it's the sneaky sugars that can cause cavities and also other things with our body, elevate our blood pressure, with caffeine content, increase our blood pressure, things like that. And
so the sneaky foods: sticky, sugary, and acidic, which is coffee. Yes. Can be acidic as well, and the sweeteners in coffee.
And I try to encourage patients that I see to Google the pH scale of whatever beverage they're consuming. And it's become like a fun game with patients and I, because they'll say, Dr. Murphy, do you know the pH of hops? Or do you know the pH of red wine? Or do you know the pH of orange juice or Dasani? Or the bottled water one is my favorite, because it is a huge industry, but yet that varying range of acidity, less than 5.4 is where we start seeing cavity formation,
Okay.
where it starts to erode away at the enamel, the outside layer of the tooth. So,
So lower is not better.
Correct. Yes.
Okay, important to know that.
And so things like I used to, well, I still love Sour Patch Kids, but I eat it in moderation because I remember one of my dental instructors likened it to eating battery acid. Oh, and I thought, wow. That's harsh. Or like Coca-Cola, as it's the same pH as our stomach acid that is used to digest foods.
Wow.
And so it's very, but then I encourage patients to look up the pH, because even today, as I was thinking, okay, what are some things I haven't been asked about for the pH? What have I not been quizzed on? And strawberries came up, and I had noticed, okay, the whole food strawberry is in the range of around 7. So I'm like, okay.
We're coming up on strawberry season, so everybody go pick your strawberries.
So everybody
and
go
enjoy.
eat strawberry pie. No. But I think just like the main take home is that that look at your labels, you know, the sugar content and the if you want to take a step further, look up the pH scale. And the other thing I wanted to highlight was caffeine content as well, which I do feel like we are seeing more in healthcare in the last couple decades with increase in energy drinks or availability. And so as I see my teens and adults, it's, you know, sometimes that blood pressure is high or they're feeling agitated, and some of it can be attributed to dental anxiety, but it's kind of like, oh, I had you know, this many cans of soda, I was on a third shift, or I was up studying for an exam, and then we look at the content that daily dose is below, ideally, 300 milligrams, 200 to 300, and then once we're doing the math with these hidden the caffeine content, we're looking at 500 to 800.
Wow.
And so that's where I find patients are often surprised, and I try to tell them, you know, I'm just like a dental nerd. Like, I just Google these things and I've talked about it, so I remember it, and there's no judgment. This is just a collaborative effort for your health.
Sure. So we've been talking about pH and sipping on beverages and sugar and all of that. So I have a question. If I sipped on my coffee all morning and then I quick brushed my teeth at noon, and then I had my Sour Patch Kids as my snack to get me through the afternoon rush, and brushed my teeth again at 5 o'clock, am I making up for it? And my teeth are good to go?
Short answer, no.
Oh, I thought I cracked the code.
I think the point that I try to hit home with acidic beverages, whether that's coffee, energy drink, is that below the pH level, acidity level of 5, that's where we start to really see the outer layer of the tooth, the enamel, be more prone to cavities. And so that is where I try to tell everyone, we all have our vices. Moderation is key. Try to swish with water 30 seconds after having something that is acidic, carbonated, where those can tend to make the teeth soft for a period of time. So I tell patients, okay, let's wait. Let's swish 30 to 60 seconds, wait, 30 to 60 minutes before brushing so that we're not brushing our teeth when they are soft from the acid exposure. Yes.
Okay.
And preserve the tooth structure.
Well, that's excellent information. Bad news for me, so I'll implement the swishing and wait a while to brush my teeth and brush those acid features away, so to take care of my teeth. Well, to wrap things up, I'd love to hear what makes you so passionate about dental care and the work that you do here at Family Health Center of Marshfield. I think it's super important to understand that, and I'd love to hear your story.
I grew up in a state where there was very minimal access to oral health care. There were 2 pediatric dentists in the entire state of North Dakota.
Wow.
Growing up, and then to add on the barriers of being a child of Vietnamese immigrants, generational poverty, and where Vietnamese was only spoken in our home. That was where there was a lot of learning, and I was so fortunate for the other pediatric dentists in the state to warmly welcome my family into the community. The pediatrician, the pediatric dentists. I mean, I was a part of the very programs that the patients I see are a part of. Head Start, the Women, Infants, Children program, free lunch program. I went to the poorest elementary school in the area, and so I was always inspired when I went to see the dentist, how he believed in me, and he said, you need to become a dentist. We need more women in the field. And his staff was always so welcoming, despite all the cultural things that my family and I were adjusting to, me being kind of their translator at like the age of 7. and just really encouraging me to pursue health-related careers when the highest level of education that my family had was 8th grade and GED. So like being the first to attend college in my family was a huge accomplishment, and I always told Dr. Goebel, my pediatric dentist, I'm just lucky that I graduated from college. And to hear him just say the same thing at every visit, I see it in you, and I think that eventually, that is where I was in dental school, and I thought it was surreal, but the dental school I chose specifically was because of its focus on public health and community health. It was my #1 choice, and they have community health externships for their 4th-year dental students throughout rural communities in the U.S. And so through spending time at federally qualified health centers in Maine, Texas, Colorado, Missouri, where I was eventually hired before I graduated, it just really opened my eyes to the work that needs to be done in these rural communities. I mean, we think of the U.S. and the big cities, but I think the important thing to remember is that 1/5 of our population lives in rural communities. So that access to care in these what can be low resource areas is really important. And so, when I have a patient that comes in more than just seeing, okay, here is a tooth, I see here is, the patient may be late, perhaps they were working on the fields, perhaps they had to catch a ride with their friend because they didn't have a car. So this tooth provides me a window to the person, their neighbor, and their role in the community. And so I think being raised in a smaller rural area really showed me that importance of being an active community member. And with the student externships, I wanted to join Marshfield, but it was a very popular rotation because of the amount of clinical experience. And so it worked out where there was finally a position after a couple years, and I've been able to be an instructor for the school that I graduated from, and we have dental students rotating through, and it's always great to learn what's new in oral health care, but more importantly to hopefully inspire perspectives to consider providing care in these underserved communities.
Well, that will wrap it up for From Help to Care, here sponsored by Family Health Center of Marshfield, and we'll be happy to see you next time with our next topic.